Well, I think sacroiliac joint dysfunction is a really larger problem than we imagine. And that's because many patients are affected by it. If you've had previous back surgery in the lower lumbar spine, you're often affected by it. If you've had a gait abnormality from your knee or hip or other joints that leads to dysfunction of your gait, you're often affected by it. If you've had childbirth, which again, many of our female patients have had, you're often affected by it. So this dysfunction of the SI joint has been there for some time as a major issue, many times mistaken for hip dysfunction, spine dysfunction, or other diseases, often misdiagnosed. So I'm so glad now we're seeing an increased focus on SI joint dysfunction because it really impairs function, quality of life, and pain in many of our patients. I've really put my attention on new therapies for SI joint dysfunction, but unfortunately I wasn't seeing the outcomes I had hoped to see. The recovery period for the minimally invasive approach, the LinQ system, has been quite nice. We've actually done several cases now, and our outcomes have been really pretty amazing to me. The limitations of function post-procedure are minimal. People can get back to activity very quickly. Once you get to that fusion point at 6 weeks, you see actually hopefully a long-term outcome solution. I saw the first one we ever did, the first patient we did with the posterior approach with the LinQ system just back a few days ago. And that patient told me that his quality of life had improved dramatically. In fact, he was back now to deer hunting, which was one of his favorite things to do. And he was able to go deer hunting for the first time in 7 years. 7 years is a long time in your life. To hear that they're actually back out functioning again really makes your practice worthwhile.